Today we're going to give an IM injection. We received an order for 0.4 mils of sterile water. So first thing we're going to do is we're going to verify these orders. We're going to make sure that it's for the right patient, it's the right medication, right dose, going to the right route, the right time. We're going to provide right documentation. So we're going to head to the fixes. We're going to provide hand hygiene, wash our hands, put on gloves. And we're going to pull our medication out of the fixes. And when we get it, we're going to make sure that it is not expired, which it is not. And we're going to wipe the top of the vial with an alcohol pad because this is a multi-use vial. Okay, so for an IM injection, we're going to have the appropriate syringe and needle sizes. I have chosen a 1 ml syringe because we have an injection of 0.4 mils. And the appropriate gauge sizes for needles are 19, 20, 21, and 22 for IM injection with length sizes of 1, 1.5 to 2 inches. So to prepare our injection, we are going to draw up 0.4 mils of air into our syringe. We are going to inject that air into our vial. We are going to draw up a medication. As I'm drawing up this medication, I am checking for a second time our 6 rights for medication administration. Right patient, right medication, right dose, right route, right time, right documentation. I'm going to recap my needle using the one-handed scoop method for safety. And I'm going to remove this needle. I'm going to place it in the sharps container. I'm then going to put on a new needle that is of appropriate gauge and length. And I'm going to label this injection with the appropriate information for safe transport to our patient's bedside. Once we get to our patient's bedside, I'm going to wash my hands and introduce myself to the patient. I'm going to explain to them that I've gotten an order from their doctor for an IM injection, and I'm going to explain to them the 4 sites that they can choose from for this injection. There's the deltoid, there's the vastus lateralis, there is the dorsal gluteal, and the ventral gluteal. They have chosen the deltoid, which is 3 fingers down from your acromion process is how you find your injection site. So, I am going to prepare my equipment. I'm going to check my patient with 2 identifiers, and I'm going to ask them again if they have any allergies and check if they have an armband, and they do not. And they're going to relay back to me their name and date of birth before I give their injection. And now that I'm here, I'm going to double check again that this is the right patient, this is the right medication, in the right dose, at the right time, in the right route, and will provide right documentation. So to prepare our site, we're going to clean it with an alcohol pad. We're going to let that air dry for comfort. Letting it air dry helps it to not stink. Uncap our needle. We're going to spread the skin. And in a dart-like motion, we're going to go into the muscle. Inject our medication. Let go. And this will go into the sharps container. I will then provide hand hygiene again. Ask the patient if there's anything else that they need, and come back to double check to make sure that there's the right therapeutic effect for our injection. The end. Bye.